Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Maida Amir and I am Assistant Professor in Department of Anatomy. Today our topic of discussion is the true and the false pelvis along with its all borders and a little bit about the pelvimetry. But before the start of pelvic boundaries, it's very important to know the anatomical position of pelvis. You can see in this picture that this pubic symphysis is tilted forward and the whole pelvis is tilted forward. And the anterior superior spine and the pubic tubercle are in the same vertical plane, and the sacrum is concave and it is also facing downward and forward. This is the exact anatomical position, and consider this white board as a fixed point, and you can see it from its front view and then from its side view. So this is the anatomical position. Now we will go to the boundaries of the pelvis. As we have already done the structure of the hip bone, pelvis in both male and female is formed by the two hip bone, one right, other is left. Posteriorly is the sacrum. At the lower part of the sacrum there is a coccyx, and anteriorly there is a joint which is called the pubic symphysis. This pubic symphysis is a secondary cartilaginous joint which is formed by the fusion of the two pubic bones in the center anteriorly. The pelvis is divided in the two parts in both the male and the female. One is called the true pelvis and other is called the false pelvis. The false pelvis is also called the greater pelvis. This greater pelvis contains the viscera of the abdomen. It lies above the pelvic inlet in this area, and it is bounded laterally by the ala of the one ilium bone and posteriorly by the sacrum, and then on the other side laterally by the ala of the other iliac bone. Now the true pelvis, which is also called the lesser pelvis. The true pelvis contains the pelvic inlet and also contains the pelvic outlet. Now we will do the boundaries of the pelvic inlet and the pelvic outlet. Pelvic inlet is bounded by the two imaginary lines which are called the terminal lines or the linea terminalis. So on the right side the right linea terminalis and on the left side the left linea terminalis. Now I will demarcate the linea terminalis on this model. Linea terminalis, which is the sacropromontory posteriorly, ala of the sacrum, arcuate line on one iliac bone, pectineal line or the pectoral pubis, pubic crest on the one side and then the pubic symphysis, and on the other side again the pubic crest, then pectineal line, then arcuate line, then ala of the sacrum, and then the sacropromontory. So this whole structure forms the pelvic inlet. If we draw an imaginary line, then the pelvic inlet is always obliquely placed, and this oblique line runs from the pubic symphysis up to the ala of the sacrum. This is the oblique line, and that oblique line demarcates the pelvic inlet. Now the pelvic outlet. The pelvic outlet, which makes a straight angle, the pelvic outlet is bounded posteriorly by the coccyx vertebra. Anteriorly it is bounded by the pubic arches. These are the pubic arches of the both sides, and laterally by the pelvic surface of the hip bone. So the pelvic surface means this whole part which contains the pelvic surface of the ischium bone from one side and the pelvic surface of the ischium bone on the other side. So this is the pelvic outlet, and this forms again a straight angle. Means its posterior boundary is formed by the coccyx bone or the tip of the coccyx, anteriorly by the pubic arches. Laterally there is a ligament which is called sacrotuberous ligament, and this ligament extends from the sacrum up to the ischial tuberosity, or you can say from the lateral surface of the sacrum up to the ischial tuberosity, and this ligament forms the lateral boundary of the pelvic outlet. So the two angles in the pelvis, one is the straight angle which forms the pelvic outlet. Other is the oblique angle that forms the pelvic inlet. So these are two angles in pelvis, the straight one for pelvic outlet and the oblique one for the pelvic inlet. Oblique angle of the pelvic inlet runs from the pubic symphysis up to the ala of the pelvis, and the straight angle for the pelvic outlet extends between the two ischial spines. These two are ischial spines and the angle lies between them. Again, I will place these pens so that you can see this angle clearly. In between the pelvic inlet and the pelvic outlet, there is a cavity that is round in shape, and this is called the pelvic cavity. This pelvic cavity contains a pelvic viscera. Below the pelvic outlet is the pelvic diaphragm that I will show in another model. This model justifies a pelvic diaphragm. This whole part here or whole concavity which forms the pelvic diaphragm. Below the pelvic diaphragm or on its inferior surface lies the area which contains the perineum. So the pelvic diaphragm contains the muscle that we will discuss later. And on this model you can see the blue colored ligamentous structure, and this structure is called sacrospinous ligament because this ligament runs between the sacrum and the spine of the ischium. So this is sacrospinous ligament, and the sacrotuberous ligament is absent on this model, but I will tell you the location of the sacrotuberous ligament. Again, from the lateral side of the sacrum up to the ischial tuberosity, and you can see like this, and this is the exact position of the sacrotuberous ligament. From the lateral surface of the sacrum up to the ischial tuberosity, that is the exact position of the sacrotuberous ligament. This is sacrospinous ligament, and these are the muscles that form the diaphragm of the pelvis. The diaphragm, as you can see in this model, it always forms a concavity, and on the outer surface there is not concavity but convexity.